Today on Primary Care, we're broadcasting from the historic Hartford Memorial Baptist Church in Detroit to talk to Black maternal health advocate Leseliey Welch.
It's important to consider that increased access to a system not designed to value Black birthing bodies is not going to improve our outcomes.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health of African Americans. Black mothers and infants are dying of disproportionate rates across this country. Here in Michigan, Black women are nearly 2 times more likely to die from pregnancy-related causes than white women, and Black babies 3 times more likely to die within the first year of life compared to white babies. These numbers are even worse in urban areas like Detroit, and research shows they are not getting any better. But there is some good news, and that is there are strong and passionate individuals working on the front lines to combat this trend. Our guest today is one of them. Leseliey Welch is co-founder and CEO of Birth Detroit and co-founder and co-director of Birth Center Equity, a nonprofit organization born out of the need for a safe place for mothers to give birth during the COVID-19 pandemic. Ms. Welch, welcome to the show and welcome to Primary Care.
Thank you for having me.
Leseliey, set the stage as to why Black pregnant women and mothers are dying at an alarming rate. What's the story behind that?
I would say the story behind it is that we live in a society that continues to distribute money, power, resources, respect, and quality care based on a hierarchy of human value that values white bodies over Black and brown bodies and does not value Black birthing people. And it shows up in how we're treated, and it shows up in the care options we have access to. One example, the Giving Voice for Mothers study found that 1 in 6 folks have experienced mistreatment or discrimination in healthcare, and folks who are Black are, of course, more likely to have experienced discrimination and mistreatment, as well as folks who are accessing hospital-based care.
What did your organizations experience during the pandemic?
So for us, Birth Detroit, we are a local Black-led nonprofit currently providing prenatal care, postpartum care, and childbirth education, and raising money to open the birth center. And so when the pandemic came about, we got a lot of calls of folks asking if our birth center was open because people were looking for a place to give birth where sick people were not, and wanting to avoid hospitals overcome by COVID-19 at the time. And sadly, I mean, we here in Detroit had to say, you know, our birth center is not yet open. We're still working.
Because of all the usual and customary reasons.
To get our birth center open, yeah.
Talk a little bit about the role of doulas and midwives in this whole concept of birthing.
Yes, I would actually love to decouple doulas and midwives because I think there's, we often hear about them together, but our work really emphasizes midwives, and, midwives are licensed healthcare providers trained in normal physiological birth, and midwives provide high-touch, low-tech care. And
I wouldn't say low tech. I know a few midwives, a couple patients.
Not low tech,
yes, they do serve a place. Yes.
Yeah, in terms of like surgical intervention, right? So no surgical intervention, but we know, right, as from a public health perspective, that 80 to 87% of us could safely give birth with midwives in a community setting. Yet we do the opposite.
Even with the lack of prenatal care, even with the lack of nutrition in the environment that we see these mothers in, even with all the issues they bring to the hospital once they're there to delivery, we're saying we can achieve those numbers, 80%?
I think that it would require, right, a real shift in the culture of birth for
Yeah,
us to, prioritize and see a shift in
but it's not
midwifery
an
care.
impossibility.
It's not an impossibility. And I do think that midwives are part and parcel of the answer to the maternal health disparities we face and the maternal health care deserts, right? We have a lot of counties in Michigan who meet that definition, and midwives, access to midwifery care is part of the answer.
What's the role of the PCP, the primary care physician, who in this instance is 99% going to be an obstetrician gynecologist, functioning as a PCP for the pregnant mother? Even though there are others out here who play that role, the numbers are very small, very low single digits. What's the role of the primary care physician in acting and cooperating, collaborating with the nurse midwife practitioner?
So I think collaboration is number one. We have some, recent recommendations of integration of midwifery and midwives into our healthcare system, and that would require sort of a knowledge of midwifery, a respect for it, seeing and understanding its role in the healthcare system, and then there's the opportunity for shared care and care coordination and risk assessment and seamless transfer between birth centers and hospitals when it's indicated, and providing holistic care for families.
Let's shift the gear a little bit here. Something that always comes up because it can't be ignored, and that is the racial complexity of these conversations that we have. We've got every study. Just fill in the blank of the disease state that you want, and it is very common to discover that study after study has shown that African Americans in this country do better, live longer, improve if there's the integration of African Americans into their healthcare as providers.
Absolutely.
How does this work in terms of the birthing business? Because we know that right now we're losing this ball game, losing this game in terms of the numbers alone. How do we begin to shift these numbers? We've got to go back to some of the basic things that worked for us years ago in terms of understanding what the community needs are,
Yes.
what the gap is between the community needs and providers. And I'm a firm believer that nothing happens in this world, and especially in this business, unless there is a financial component to it.
Yes. I would say we need more Black midwives, right? When we think about our ancestors, we have a rich legacy of
I was delivered
midwifery,
by a nurse midwife
right?
in a hospital
In the hospital.
in Alabama.
In Alabama. Yeah.
Yeah.
So, and most of our ancestors, were delivered at the hands of midwives. And when we talk about the combination or the potential of the combination of midwifery care and cultural congruence in care, it is protective for us. We have a recent study of Roots Community Birth Center in Minneapolis, right, that found that folks who had care there were more likely or experienced greater autonomy and respect, no matter their race, at this Black-led birth center. And then when you looked at the Black birthing people, their outcomes are even better. That it was protective to be in an environment where there was some understanding of the context of your life, some commitment to racial justice, some respect and reverence for your culture.
Okay. So Shalita Monroe, a pioneer in midwifery, she's come up with 5 things that she thinks are very important to understanding this whole complex of things when it comes to Black mothers birthing Black babies. First, she says, ignoring Black women's plea for attention. Wow. That's amazing right out of the box. Nobody's listening to me.
Yeah.
Every single medical issue that we have, we can apply that to them. The unconscious bias against Black women.
Yeah.
And we find sometimes that this unconscious bias not just necessarily be by non-Black people.
Right.
Okay, we have to be honest and fair about that, okay? Dismissing the healthcare needs of pregnant and postpartum women as if to say, oh, you don't need that. It's okay for them to have it checked off on their box. It's okay for you to leave it unchecked. Those things happen all the time. Not believing Black women when they say something is wrong.
Absolutely.
Like in heart disease, we stumble over that every day. And what I do, because we're not listening well enough to Black women who are telling us, I just don't feel well, and it's really their heart.
Absolutely.
And lastly, allowing Black postpartum mothers to die. That one struck me because if somebody had told me it was happening, I would have said, yeah, probably so. Everything else is. Can you expound on that one a little bit? We got some real numbers there or something?
Yes. So first, I would just acknowledge Mama Shafia Monroe as a elder midwife, well respected in the midwifery community, and agree with what she shared. And I, would say that one of the ways in which we disembody Black women is that we talk at the level of the statistics and not at the level of the care provided to a person. And when we talk about maternal mortality and morbidity, we don't talk about what happens after the baby is born. We don't talk about how our current care system sort of is hands off until 6 weeks postpartum appointment. In midwifery model care, the midwife is going to visit you at your home in the birth center model of care, right? There are midwives practicing in hospital, birth center, and home. In the birth center model of care, a midwife is going to visit you at your home within 48 to 72 hours and visit you thereafter. And they're going to catch things like problems with blood pressure, irregular bleeding, any of those things that would potentially lead to a bad outcome postpartum. And for the postpartum period, we know that the majority of maternal deaths result in or are in that postpartum period, and more than half of them are preventable.
Are Black women having trouble getting in to see obstetricians?
So, what I would say about that is that it's important to consider that increased access to a system not designed to value Black birthing bodies is not going to improve our outcomes, right? So we can talk about access to obstetricians on one hand, but what I'm an advocate for is talking about access to midwifery model care because it is a comprehensive, evidence-based model of care that cares for the whole person and the family. And I know that that can make a difference for us in our outcomes.
Very good. Leslie, give us a little bit of perspective on the history. You know, sometimes you get a little older, we forget history, we forget our past, and you don't know whether you remember somebody from junior high or high school or college or church. They run together. Give us some perspective on the history of midwifery for Black folks in this country, because it is certainly a great deal of our legacy.
It is. We have such a rich history and legacy of midwifery in this country. All of our ancestors were born at the hands of midwives. And we have, a rich legacy continuing, but in a very scaled down way today of midwives, Black midwives practicing and catching babies in our communities. And I think what people don't necessarily know or realize is that there was a deliberate racialized effort to undermine Black midwifery in the 1900s. And it looked like academic journal articles that were titled The Midwifery Problem in the United States. It looked like the Shepard-Towner Act in the 1920s that started to professionalize midwifery. So our midwife ancestors were apprenticed as midwives. The Shepard-Towner Act made it required, right, that there was education, there was certification, there was approval, there was connection to physicians, and it professionalized midwives as nurses, making that profession then less accessible to Black women.
You know, the only problem I have with the legislation, it was Black folks for Black folks in a substandard way. Okay, I mentioned earlier, I was delivered by a midwife.
Yeah.
Probably one of the last of the Mohicans. But either way, as I recall my parents relaying the message to me,
Yeah.
it was in spite of, not because of. And so it was a substandard, But that was years ago, okay?
Yeah.
50, 60 years ago. Now it should be totally different. There
It should
should
be
be
totally
no,
different.
absolutely.
And, it's an example of, I listened to your interview with Dr. Kamara Jones, who I love, and she talks about, this initial historical insult that has never been addressed, or it continues to be perpetuated today. So with the combination of that legislation in the 1900s, we saw birth move out of the hands of midwives into the hands of predominantly white male obstetricians and into hospitals. And then when we do see midwifery coming back into, birth culture, we see it with white midwives.
Sure. Let's dig into the history a little bit more in terms of midwifery amongst the Black community here in the States.
I would share first, I think important that I'm not a midwife myself. I think because I'm co-founding a birth center, and because of my advocacy for midwives, a lot of folks think that I am a midwife. But I love and respect midwives and know that we need midwifery care. And in addition to what we've kind of already talked about midwives being the primary birth care providers at one time and the shift, I would just pull that into present day and say, now we have a situation where the majority of Black folks are channeled into highly medicalized care that is not necessarily indicated, because we have no other choice but hospitals and obstetricians for where and with whom to have our babies. And so while we have Black midwives today, we don't have nearly enough. And we have some barriers to overcome, I would say, with midwifery education, improving access to midwifery education in this country for Black students seeking to train as midwives. Also, when we look at birth centers today, we have very few that are led by Black folks in this country. We have almost 400 birth centers in the United States, and less than 5% are owned or led by Black, Indigenous, and people of color. And that shouldn't be.
I understand you have somewhat of a personal story related to this.
Yeah.
You want to tell us a little bit about that?
I fell in love with birth as a birth doula myself, right? So doulas provide non-medical support during pregnancy and birth, and I was a doula in graduate school before I had my own babies. And then I would go on to have my own babies and experience the joy and the grief that comes with pregnancy and birth. So my first baby, my Zoe, was born premature and spent some time in NICU. I know what that is like. I had a late-term loss. I know what that is like. My next baby was born on their due date, so that was a different experience. I had both my babies with midwives, but in hospital, a birth center was not an option. I've also experienced infant loss vicariously through my sister-in-law and brother-in-law, who lost their son here, born too soon and too small, and died the same day.
I think all of us have been affected by
Right, and
these
so
kinds of things. Yeah.
I think once you are impacted, I no longer see only numbers, right? So as a public health professional, we talk numbers and stats all the time, and I think I've done some of that in this conversation, but what I know and see and feel as a person is like, these are my babies. These are, my sisters, my families, my brothers, and that those losses that we experience, that we talk about as a statistic, as a one-time occurrence, have a ripple traumatic effect in our community. That heartbreak is not isolated to the one day that a person died,
Sure.
or to the one day that an outcome is poor.
Okay.
And we see the legacy of that in the fear we have in our community.
And our society and healthcare is focused on the senior citizen population so heavily that we see some of the same instances that you're talking about at the beginning of life and at the end of life also. There's certainly a great need for this kind of communication and education across the spectrum of what we're talking about. So how do we better educate Black mothers? How do we get the word out that Birth Detroit is here? It's out there. I mean, it's there for you. I mean, what do we need to do?
So right now, we're providing prenatal care, postpartum care, childbirth education in collaboration with Brilliant Detroit on the northwest side of the city, Fitzgerald House. Folks can find out more about Birth Detroit and make an appointment for a free consultation, and our midwives will help birthing people determine if midwifery care is for them. We also plan to do a public education campaign so that our community can know that midwifery is our legacy, that midwifery care is for us, that all people deserve access to all safe birth options. And we'll be doing some, deliberately focused public education in the coming year before the birth center opens.
Okay, and already having been boots on the ground, share with us some of the success stories that you've had in affecting the life of mothers and babies.
We have one of my favorite is the mama that's featured in our Lead With Us video on our website. And she came into our care, I think, later in her pregnancy, but really is vocal about what it felt like to have Birth Detroit care. At Birth Detroit, we talk about how the spirit of care matters, that it matters that you walk in and you feel welcome, that you feel respected, that you feel loved, that you feel like we care about you. And so it has been amazing to see her journey as a cheerleader of Birth Detroit. We also, have had mamas come to us from other care providers and say that they heard about Birth Detroit and they wanted to consider Birth Detroit because they didn't feel respected or seen or heard with their other provider. And one woman said, I just want to feel loved. Right. We have also had in our care, we try to involve the whole family, right? So the whole family can come to a prenatal visit at Birth Detroit. So we have relationship and involve dads and children in the visits. And we have cared for about 100 families, a little over 100 families to date. And there have been some healthy Birth Detroit babies born with local hospital providers and some with home birth. And we feel really proud of the care that we're providing and of our midwifery team.
Good, very good. And since we're sitting in a church for this production, tell us the role as you see it of the church in the community in terms of this whole scope of issues that we have in birthing.
Yes. Oh, I would love.
You could talk all day, I know.
I would love to see the church become involved in helping us educate the community about midwifery care, about Black midwives, about Birth Detroit, and supporting our efforts not only to open the birth center and provide midwifery care, but our longer term efforts to increase the number of Black midwives in our community. There's so much work to be done.
Oh, yes, absolutely, absolutely. And not to mention, Moses was delivered by a midwife, so we can't leave that out in terms of this discussion. Good.
May I? I'd just love to name two the co-founders of Birth Detroit that people often see me and don't see. The amazing team of co-founders that brought Birth Detroit about. We have Charlie Snow, who's a certified nurse midwife. We've been talking a lot about certified nurse midwives. We have Nicole White, who's a certified professional midwife, and Alondra Frard, who's a doula, health educator, childbirth educator, health equity consultant. And so together, we founded Birth Detroit. And when you think about the idea of the troops and like who's with you, one of the things we're very committed to is to having both types of licensed midwives practicing in our birth center.
Okay. Anything else new coming down the pike? Any new collaborations on a national basis? Any new collaborations on a funding basis? What are those discussions going on?
Yes. So on the local level, I would say we will we have a capital campaign to open the birth center. So we are working to raise $4 million over 3 years. 1.5 of that is for the birth center building itself. 2.5 of that is for our first 2 years of operations so that we can sustain the birth center while we're putting the billing and so forth in place. We've raised about $1 million so far. We have a t-shirt campaign. It's This Tea Builds Black Birth Centers. Folks can find out about that on our website. We want everybody who wants to support Birth Detroit to have a way to do so, even if it's buying a mug, buying a t-shirt, or the larger checks that come our way. On the national side, Birth Center Equity is a national effort to grow and sustain birth centers led by Black, Indigenous, and people of color across the country. And we are growing a fund to make resources available beyond grant funding. So Birth Center Equity is set up to do network building for birth center leaders of color, grant making, capital investments, and to look at innovations and economies of scale to make resources available to overcome the capital barriers that we face to opening birth centers.
It's got to be a lot of hard work.
It's a lot of hard work, but it is very much worth it. Our ultimate goal is to build a community birth infrastructure that, lasts for generations to come, so that my grandchildren's grandchildren not only know what a midwife is, but that perhaps midwifery care will be normal then.
The conversation needs to be elevated so people who don't have the need for it still talk about it. It's when other people say good things about you that other people listen more.
Yes.
Not when you say good things about yourself.
Yes.
Right? So we need to elevate this conversation so that people, especially the next generation, gets involved in terms of how they feel about it. Leseliey, this has been wonderful. We could go on for hours about this and touch on a lot of bases, but thank you for joining us today on Primary Care.
Thank you for having me.
Our guest has been Leseliey Welch, CEO and co-founder of Birth Detroit. Black women deserve to have safe and healthy pregnancies and childbirth. For this to happen, we need systemic change that improves access to care and makes the places where women live, work, pray, and everything else healthier and more responsive to their needs and the child. For Primary Care, I'm Dr. Lonnie Joe.